I think the 5 most common myths about radical prostatectomy are, I think number 1 and 2 again go together in terms of continence, sexual function. Continence, one myth can be there's no incontinence, which is untrue, and the other myth can be you're going to be wearing a diaper for the rest of your life, which is also untrue. I think there's people who are completely continent after surgery, and there's people that wear diapers for a long time after surgery, but most people lie in the middle of that kind of bell curve. Most people regain their continence, and I always tell people between 3 and 6 months time, people regain their continence after radical prostatectomy, whether it's an open, laparoscopically, or robotically assisted. The second myth about radical prostatectomy is sexual function. And in terms of losing all sexual function, everybody is still able to be intimate with their patient after surgery, and everybody is still able to achieve some climax or orgasmic experience after surgery. Whether or not that climax or orgasmic experience is with an erection or not is something else. In terms of achieving that erection, some people do regain full sexual function after surgery, and that regaining of sexual function happens somewhere between 3 months and 12 months after surgery, depending on how motivated that patient was, depending on their prior sexual function. The third most common myth about radical prostatectomy is whether the operation is done open, laparoscopically, or robotically. You'll get different results. In terms of cancer control, continence, and sexual function, all 3 operations are relatively equal. And in the hands of a good open prostatectomist, laparoscopic prostatectomist, or robotic prostatectomist, those 3 outcomes in terms of cancer control, continence, and sexual function will be maximized depending on the surgeon. The fourth most common myth regarding radical prostatectomy is robotic radical prostatectomy. Now, robotic radical prostatectomy is done in over 90% of men in the United States with prostate cancer. In Canada, I think it's much less, and the issue is robotic radical prostatectomy is a very expensive endeavor. Having said that, there is benefits to robotic prostatectomy in terms of the 3-dimensional vision, the EndoWrists that the robot has in terms of manipulating tissue inside the abdomen. Having said that, a good laparoscopic prostatectomist can do all that a robot can do. And I think the analogy is, do you need a Ferrari to get to A to B? And if you can get there with a Toyota or a Honda, it'll do the same job. The 5th most common myth regarding radical prostatectomy is when one can return to work and when can one return having sexual intimacy. I don't think there is actually a specific number in terms of 2 weeks, 4 weeks, 3 months in terms of these issues. I think each individual patient is different in terms of their job, in terms of their preoperative intimacy levels, in terms of their overall fitness. And I think the one most important thing that each man has to realize is you need to listen to your body. If you want to try something and you do it and it feels right and there's no discomfort, then I suggest you continue on. If you do something and there's pain and discomfort involved, that means you need to back off and wait and try again at a later date.